I've been asked to come here today to talk about synuclein seed amplification, which is a new biomarker assay for Parkinson's disease. And in fact, it's new in that it's been really popularized in the last year due to applications in large studies, but it's actually not so new in a lot of ways. The technology was originally developed to detect prions, like you see in mad cow disease. And it dates back over 20 years. And the idea that it detects pathology in Parkinson's and that the pathology that you see in Parkinson's disease is integral to the diagnosis it dates back over a century to the first times that people detected Lewy bodies in pathological specimens from people with Parkinson's disease. But it is new in that it's recently been applied in large-scale studies, especially the Parkinson Progression Marker Initiative, which I work on, and we confirmed in PPMI high diagnostic accuracy, one, and two, interesting heterogeneity, where some subgroups of people with Parkinson's, especially people who had a normal sense of smell, which is not the typical case for Parkinson's disease, and also people that carry the LRRK2 gene, which is one of the two main genes which has been implicated in Parkinson's disease, had a surprisingly low rate of seed amplification. The biomarker was negative when we expected it to be positive, possibly implicating pathological heterogeneity within these subgroups of people with Parkinson's disease. So this was a new finding. The other finding that is new in our study was that we looked at several groups of patients who didn't actually have Parkinson's but were at risk, including people with prodromal features, especially this sleep problem called REM sleep behavior disorder, where we found a high rate of positive tests, similar to what you'd see in people with Parkinson's, indicating that these people are clearly at risk. And this has been shown previously by several groups, and we confirmed it. We also showed that unaffected gene carriers who carry the LRRK2 gene, one, and also another gene called GBA, sometimes have a positive test. And this is interesting because it indicates that the latency period between having a positive SAA and developing clinical symptoms could be quite long, because these gene carriers, during the period of observation, none of them develop Parkinson's, and probably not, will probably remain disease-free for a long period of time, maybe indefinitely. So these were the interesting findings from our study. A lot of people ask, what's the clinical utility of the seed amplification assay right now? And I answer them saying that it's useful for diagnosis, but probably not much more useful for diagnosis than other currently available modalities, including a good clinical exam by an expert or a DAT scan. However, it is a very useful research tool. It'll be useful for putting patients in the right clinical trials so that the patients who are enrolling in trials can feel confident that they're in a trial that's good for them. And it's also good for drug companies because they'll be able to put a relatively homogeneous or clean population of patients in a trial and possibly have a better chance of finding if a drug really works, if it does. So better trials and better match of patients for trials so that's really the research use right now. In the future, when there's therapies that really target the underlying synuclein pathology, which is what the assay measures, then it will be clinically useful as well. So a little bit about future directions. Right now, there's a few limitations to the test. The way we do it, it has to be done through a spinal tap, and nobody really wants to get a spinal tap. Other groups are looking at using other types of samples like skin or even skin biopsy, which can be a very small skin biopsy, or a blood sample, which is much less invasive than a spinal tap, to get the same information. And this is progressing fairly rapidly. It's actually really an exciting area where there's ongoing innovation. And the other area is trying to make the test quantitative so that you can know not just whether somebody has the trait or not, but how much of it they have. And this could be very useful for measuring change over time for trials and clinically. So that's, I think, some of the three things that make this a really exciting area, and I think it's definitely one to keep an eye on in the next few years going forward.